vaccine, so we're quite prepared to make the new vaccines for COVID when they're available and get them into people's arms in those skilled nursing facilities.
Yeah, you've got the systems in place, which is so key with getting things underway. So you think that's where CVS focuses first. When you get the first doses, they'll be going to skilled nursing facilities?
That's what we've worked out with Operation Warp Speed. They've provided us with very specific information. We're now getting the exact skilled nursing facilities that we will do. Walgreens will be doing some as well, and we're preparing our logistics for that. There's a lot of people that are working around the clock to be prepared when the vaccine's available.
Well, and that's, of course, the key point, right? How soon after approval do you think CVS will have vaccines in your possession?
Well, once the approval takes place, I think that Operation Warp Speed means to begin shipping the vaccines immediately. So I think we're talking only 2 or 3 days. So I think everyone's looking forward to the advisory committee meetings that are taking place at the beginning of December, and a final decision from the FDA after that. Once it's released, then almost immediately we'll be available to begin having these clinics and get needles into people's arms right away. I'd say mid-December.
Mid-December. That is a very promising news for so many people. So you've got Operation Warp Speed, right? And mid-December is still Operation Warp Speed, led by the Trump administration, of course. But this vaccination effort is going to continue into the next administration. And that's something that's become into large focus in this transition period. Have you as a company been in touch with the Biden transition team?
Well, we're working primarily with Operation Warp Speed. And remember, Operation Warp Speed is basically the career people at the CDC, people who worked for years in biotech and pharmaceutical agencies, and then the logistics branch of the U.S. military. So we're working with professionals there. We have every reason to believe that no matter what the administration, these are the kinds of people you choose to be leading the effort. So we're very confident that the people we're working with now are likely to be the people who we're working with going forward. Obviously, the Biden team has an advisory board. We know those people very well. Public health is actually a pretty small place. A number of those people are colleagues, friends. Some of them are even former students, I hate to say. So we've obviously had conversations with them and been in touch with them about what our plans are for distribution. We'll plan to do our part in stage 1 with regard to the skilled nursing facilities, as I said, and then we'll turn relatively rapidly over to offering vaccines in our retail stores, and we'll offer them in all 10,000 of our retail stores. And we plan to gear up very quickly to provide really substantial volumes of vaccinations to the people in stages 2 and 3 as we get into that in the latter part of the winter.
When do you think that happens? When do you think Kate Baldwin can walk into a CVS, make an appointment to come in for that first and second dose?
Well, a lot turns on what the FDA does and how quickly the FDA acts with this information. But if the stage 1 operates as it should, we'll have to be back in to do a second vaccination, obviously the booster, 21 to 28 days after the initial vaccination, depending on which of the vaccinations come to us, the Moderna as opposed to the Pfizer vaccine. So we anticipate that's going to take a 2 to 3 month period of time, but we'll begin to offer, as there's availability of vaccinations in the stores, I would hope by the end of February, beginning of March, and then we think we can move rapidly. We're prepared to we have a capacity to do 20 to 25 million vaccinations per month in our fleet of stores alone. So if you take the other major retailers doing the same thing, you can see that very quickly we can build numbers through the spring in terms of the number of people who are vaccinated.
Just got to hold on. Everyone's got to hold on and be careful until then. Doctor, thank you so much for coming on. Thank you for your work. The country will be leaning, as it often does on CVS, but leaning on CVS more than ever in this effort ahead. Thank you very much and good luck.
Thank you very much for having us, Kate.
Thank you. Still ahead for us, long lines like this, we're going to show you right here, are happening at COVID testing sites across the country 10 months into this pandemic. Why can't the system keep up?
I'm afraid it's metastatic. So I'd like to start with the Foundation 1 CDX test. Your results could help us match you to a targeted therapy, an immunotherapy, or a clinical trial for your cancer.